Hello, I'm Dr. Collins, and in this clinical skills video we are going to take a look at how to check capillary blood glucose using a finger prick glucometer. This is a genuinely vital clinical skill and one you will need far more than you might think in emergencies, in clinic, on home visits, or with any patient who's suddenly confused, shaky, sweaty, or not quite right. A quick finger prick glucose check is often the very first test you will want to reach for. This clinical skill can feel daunting at first, but once you know the simple steps, it becomes a quick, reliable part of your routine that can genuinely be life-saving. And although every glucometer is slightly different, the key principles of the skill are pretty transferable. So once you've learned it properly, you can pick up any meter with confidence. First step is to check that you have all the right equipment before you start. You will need a blood glucose meter, test strips compatible with your meter, a finger prick device, an alcohol wipe, cotton wool or gauze, and a plaster just in case the bleeding doesn't stop. In this instance, I'll be demonstrating the procedure on myself, but in a clinical setting, you will also need some gloves, a disposable container for sharps, and a recording log or electronic patient notes to write down the numbers at the end. Next, you will need to prepare your skin pricking device. Some devices are ready straight away, but others, like this pen-style lancet, need to be primed. When it comes to skin pricking, you have three main options. Option 1 is single-use safety lancets. These come in various colors, shapes, and needle sizes, but the way you use them is essentially the same. You twist and remove the safety cup, press the device directly against the fingertip, and then dispose of the whole unit afterwards. This option is great in terms of safety because they operate with an internal automatic retraction mechanism, which locks the needle away as soon as it is triggered. The second option is to use a simple single-use lancet needle, where you twist off the little blue circular cup and apply the needle directly to the patient's fingertip, which can feel a little less steady and therefore higher risk of accidental needle stick injuries, but it is a good option in the sense that a small amount of waste is created. Last but not least, the third option, which is what we're going to demonstrate here today, is the pen-style lancing device. This one is a bit more involved because you need to insert a new lancet needle into the pen and prime it before use, but these devices tend to offer the best combination of safety and reduced waste, since again only the small lancet needle is discarded at the end, and also it has the internal safety retraction mechanism as well. There are lots of different models of pen-style lancing devices, but they all work roughly in the same way. To prime the pen-style lancet, twist and open the pen. Remove the little circular blue cup of the lancet needle and firmly insert it into the lancet holder. Replace the device cup, making sure it locks with a click. And finally, set the penetration depth of the needle using the dial. Now set aside your primed pen-style lancet and turn your attention to preparing the skin. We will wipe the chosen finger with an alcohol wipe. In order to minimize the discomfort, it is best to prick the sides of the fingertips as they are less sensitive than the center of the fingertip pads. Next, pick up your test strip and take a moment to check the expiration date. An expired strip can give an unreliable reading. Take out a single test strip. Insert your strip into the glucometer. Most meters will wake up automatically and the screen will usually prompt you to choose the context of the test. Depending on the models, some older glucometers will simply turn on and accept the test strip without offering any additional options. Newer models, such as this, often provide context tags, such as GEN for General Anytime Reading, AC for Before Meals, here also shown with a whole apple icon, and PC for Post Meals, which some devices display with an eaten apple icon. Once the desired setting is chosen, we're going with the post-meal option in this case, set the meter aside. To obtain a blood sample using the primed pen-style lancet, press the device firmly against the selected fingertip and activate it by pressing the release button. After lancing, squeeze the finger and wipe away the first drop of blood. This will remove any residual alcohol, tissue fluid, or surface contaminants that could affect the accuracy of the reading. Gently squeeze the fingertip again to produce a second drop of blood. Bring the strip to the blood drop and allow the strip to draw it up. The glucometer will light up and some models may even display a brief countdown before showing the result. if the finger continues to bleed, or if the patient prefers, apply a plaster to the site. Thanks for watching. If you like this video, please like and subscribe. And don't forget to check out our other clinical skill videos, our quick medical mnemonic videos, and the longer in-depth clinical concept videos. Good luck!